Hi, I'm Isabel. I'm the Critical Care Supervisor at Windcrest, the Animal Hospital. This is Artie, and today we're being joined by Dr. Kram. Dr. Kram started at Windcrest about a year ago, and since then we've had lots of questions about what he does. So today we decided to bring some of these questions to him. So, Dr. Kram, can anyone do acupuncture?
Well, actually, any veterinarian in the state of Delaware can do acupuncture. However, to be a certified veterinary acupuncturist, like I am, you must complete a program that is at least a year in length, and which you sit for an exam. It's a 2-day exam, and in the case of being certified by the International Veterinary Acupuncture Society, which I am, you must be able to certify in 2 species. In this case, the dog and the horse for meat.
Oh, okay. Wow, that's interesting. And what exactly is integrative medicine?
Integrative medicine is actually the blending of Eastern and Western. And Isabel, you know, as one of our senior veterinary technicians, that I consult with the veterinarians here who are doing Western medicine. Those are the vaccines, the surgeries, etc. And what we do is we decide what the best care for any particular animal is. So in certain cases, like a dog, say, who has arthritis, maybe on multiple medications that are working but just not getting as far as the owners or the veterinarian would like. So they'll consult with me and they'll say, by the way, could we add an Eastern component? Could we do acupuncture? Or the other benefit that we have here at Windcrest is that we have Dr. Kate doing physical therapy. And so very frequently, dogs that are getting physical therapy post-operatively to help them walk, to help them build up strength, can get pain relief. They can get additional support from acupuncture. So in many cases, we do both therapies together.
Great. And so you've talked about how you did the horse and the dog. Can cats also get acupuncture?
Great question, and we actually have a couple of cats here at Windcrest who are getting it. Cats are a little bit temperamental, you know, they're independent, but actually once they've had a needle or 2 placed, I have one cat right now, Dewey. He comes in, he hisses at me first, and then he just goes to sleep on the table. So it's very easy and very beneficial.
Okay, and so if you're doing a cat and then you also have a Great Dane, they're very different sizes. Are the points in all the same locations on their bodies?
Great question again, and indeed the points are there, but as you pointed out, the difference in size does make a difference. And if we were to say, for instance, that this point is 3 inches below the knee, 3 inches below in a Great Dane, and 3 inches below in a Dachshund, you got problems because the Dachshund, you're off his leg already. So what the Chinese developed was a system of measurement called the sun. And it is proportional to the size of the animal, so that we know the distance, if Artie will let me show, between his knee and his hock over here is actually 13 sun. So if I know that a point is, say, 3 sun above his hock, it's going to be easier to figure that out, because if I know the distance from this finger to this is 13, half of that is going to be about 6.5, and then half of that's going to get me to 3. And I know you love that, Artie, right?
Yes. Okay, so how about needle sizes? Are they very large? Does it hurt when you put them in?
Well, I've had acupuncture myself, and I can tell you that it did not hurt. And I can also tell you that I don't think I've had one complaint from clients here at Windcrest about, oh, Dr. Kram is hurting my dog. Needless to say, if they have some painful spots, we may avoid those at the first or second treatment. And the nice part of acupuncture is we can go on either side of the body. So if the right leg is affected and very painful, we can treat the left leg, except I got my right and left mixed up. And the needle situation is something that is very interesting. I'm going to use a sheet of white paper over here just to point out. We know that when you're drawing blood or using or giving a vaccine, this I believe is probably a 25 gauge needle, and that is what we would call a baby needle in Western medicine. However, look what we would call a baby needle in Eastern medicine, and you can see it is considerably smaller.
Oh,
this
yeah.
is 25 gauge. This is 32 gauge. And depending again on the animal, we can use even smaller needles, and these are called Korean hand needles. And as you can see, they're really, really tiny.
Wow, they
and
are tiny.
We use them as disposable needles, so only one per treatment, one per animal in a particular spot.
Great. And what are some different symptoms that you may treat with acupuncture?
Well, when we talk about signs that dogs have, pain and inflammation is a primary one. If you have a dog who's in pain, if you have a dog who has some type of inflammatory disease like arthritis, in certain cases allergies, in certain cases seizures, these are all things that we can treat. I usually, like when I talk to people about that, I start at the nose and I work back. And I have a couple of clients who have dogs with dry eyes where they're not producing enough tears. They're seeing ophthalmologists, they're on medication, but they still are squinting, etc. And we've been treating these dogs with acupuncture and they are actually getting better. Ear infections, those Labradors that constantly, or Cocker Spaniels, in many cases, ear infections, again, we can't do without the topicals and the cleaning, but we can add acupuncture to this, and again, it makes them more comfortable, it relieves that pain, it relieves the inflammation. As we move back, a lot of coughing, a lot of lung disease. Right now, I'm working on some dogs who have laryngeal paralysis. They can't kind of breathe as well, they cough a lot, and this helps. And of course, the hind end and all those conditions that are associated with aging. And as we kind of close out, the last thing is cognitive dysfunction. Those older dogs that just kind of don't remember where they are, they don't remember to go to sleep at night. We can help them.
Great. Now, can anybody just come in and see you, or do they need a referral from the regular vet?
Great question, and we're here to help everybody. Ideally, again, because we practice integrative medicine, I like the routine regular vet to know that they're coming in so that he or she and I can kind of converse and talk about it. But you can call and set up an appointment yourself without a referral.
Great. Would you mind showing us a little bit with the needles on Artie?
Absolutely. Would you mind, Artie? We're going to take, I'm only going to do one needle on Artie today. We're going to use a very small needle, as we can see. And again, Artie's a small dog, and I'm going to put it in a very, very common point that we use in hind limb problems, and this is called Bawe, and it's right in the center of the spinal cord, and I'm going to give it a quick tap like that, and we didn't see Artie jump, didn't hurt, and it's doing its job, and we would normally leave that in for about 20 minutes. So the hardest part for the owners are they have to stay in the office with their animal for 20 minutes. But in many cases, we'll let the dogs or the cats walk around. Or as I said, the Dewey, my big cat that I'm treating right now, he just falls asleep.
Well, fantastic. Thank you so
Out
much
there, big fella.
for answering all our
perfect.
questions today, Dr. Kram.
It was great, and I'm looking forward to meeting more Windcrest clients.
Fantastic. I'm Isabel, this is Artie, and our special guest today was Dr. Kram.